Hey, folks, we're about to do this episode with Dr. Drew, and I know some of you are new to the show, or maybe you don't know about every episode that we've ever done. There's a lot of them. But if you like this Dr. Drew episode, then maybe you should check out episode 454 with Phil Stutz. He's a therapist, and we had an amazing conversation. People still tell me it's one of their favorite episodes. Also, in the early days of WTF, I used to talk to my friend Dr. Steve Danziger about all sorts of things. Those are episodes 34, 46, 55, and Dr. Steve's full interview is on episode 230. Get the free WTF app and then upgrade to premium to hear these episodes and every other episode we've ever done. Oh, hell yes. All right, let's get on with the show.
Lock the gate!
All right, let's do this. How are you, what the fuckers? What the fuck buddies? What the fucking ears? What the fuck sticks? What the fucks the bulls? What the fucking hams? Yeah, all right. How are you? It's Marc Maron. This is WTF. I'm out here in the garage wearing a toque, wearing a hat. You know, when that old thermometer drops below 70 out here in Los Angeles, it's time to get the hats out. Chilly. I'm a East Coast person at heart, or at least a seasonal person at heart, and I miss layering up, so I'll look for any opportunity to get layered up. That's just the reality of the situation. Halloween, not a successful night for me. Laid low, hung out with a friend, and, bought some candy, as I always do. I'll buy a bag of candy, I'll leave that light on, but no one's coming up my hill. You know, I don't know if I imagine the kids can handle it, but maybe the parents are like, I don't need that much exercise. I don't know. I dressed up again, third year in the row for Halloween. I dressed up as the cranky guy in a robe. Yeah, that was me. Cranky guy in a robe. I think that somebody tweeted that there's no shame in the crotchety wizard costume. I don't know if I could rationalize it that far. Here's the problem with no one coming to get the candy, because then you know what? It's like, fuck those kids. They don't come get the candy. Who's got the candy? I got the candy. On some level, that's a win, I guess, but now I got a bag of candy. I got the mixed bag with the Milky Ways, the Snickers, and the Twix, and the Milky Way only caramel. Where the fuck did that candy come from? Halloween comes along, and then I don't know about these candies these kids are eating now. It's like the old sober guy. I wasn't around for ice. I wasn't around for ecstasy. You know, I missed out on oxys. You know, sometimes I wonder what it would have been like if I could only have had an oxy. But I've been sober too long. I'm missing out on all the good candies. Milky Way only caramel. Jesus. That might as well be oxy. Yeah, so I had 9 of those. A couple of Twix bars. This morning, I woke up with candy wrappers in my bed. So, I'm in trouble. So I'm in trouble, man. It's a slippery slope to oxys. Dr. Drew is my guest today. I talked to Dr. Drew about medication, about drugs a bit. I talked to Dr. Drew about a lot of stuff. I know some of you have, mixed feelings about Dr. Drew, but I think we had a good conversation. And you know what? I generally need a doctor. So that worked out. But I think it was thorough, and I think, whether you like him or you don't like him, you're going to get a sense of who Dr. Drew Pinsky is. I know I did, and I was happy to talk to him. So that's coming up in a second. Is that all right with you? Is that all right with yous? Huh? Is it? It's Stamps.com time. And you might be wondering, what more can I tell you about Stamps.com after all this time? But the truth is, I don't need to tell you much more than what you guys tell me. We hear from people all the time who tell us that mailing letters and packages got a lot easier thanks to Stamps.com. And why wouldn't it get easier, folks, when you can mail and ship anything anywhere using just your computer and printer and without more trips to the post office? You dig? With Stamps.com, buy and print official U.S. postage right from your desk. Stamps.com does all the work for you. They even give you a digital scale that automatically calculates exact postage for any letter, any package, any class of mail. And setup is easy too, folks. In minutes, you'll be printing your very own postage, and it's so easy. Anyone can do it. Just click, print, and mail. Right now, when you use my promo code WTF, you'll start a no-risk trial, plus get a $110 bonus offer that includes a digital scale and up to $55 of free postage. Don't wait! Go to Stamps.com, and before you do anything else, click on the microphone at the top of the home page and type in WTF. That's Stamps.com. Enter WTF. Oh, yeah. Before I forget, I want to tell you that Brian Jones made some more mugs. You know, we have these mugs that I used to just give out to guests on the show, these beautiful ceramic mugs. And there's a potter up in Portland named Brian Jones. He makes these mugs. He made them for me to give to guests as sort of a thank you gift for doing the show. And we've made them available in batches because they're hand-thrown, so they can only be made in batches. And I generally tweet them. And I don't give you listeners the heads up. And I said I would, and I am. So there's a new batch of mugs. I don't know how many are there. But, yeah, I'm sure you could get one. I hope so. But I wanted you to give the heads up before I went to Twitter. And I'm sure that they'll be gone. And we'll just let the Twitter people hang. Because they've had the first shot on most of the last batches. But I promised I would give you the heads up. And here it is. Go to brianrjones.com/shop. And there are these beautiful mugs that he designed for my guests, for the guests of WTF, and now available to you. These actually would make great Christmas presents if someone's a fan of my show. They're beautifully handcrafted, and they're awesome. And I'm telling you first because I said I would. All right? brianrjones.com/shop for the amazing hand-thrown mugs. And look at his other stuff, too. He's a wizard up there. He's actually got a podcast, too. I inspired him to do a potter's podcast, ceramics podcast. But nonetheless, the mugs are there. Go get them. I didn't tell anybody else. All right? Last night, I went and saw the Tedeschi Trucks Band with Gary Clark Jr. at the Greek. I don't go to concerts, but lately I've been offered to go. Would you like to come see these people? Yes, I would. Now, I met Derek Trucks and Susan Tedeschi at Conan briefly, and they gave me the record. I know they're brilliant musicians. Every respected guitar player I ever talked to, is like, Derek's the dude. And I don't know if I had a full sense of what he is or how he plays or where it comes from, but man, that was one of the best shows I ever seen in my life. Do you know what it's like to be in the presence of fucking genius? I mean, to listen to a guy play guitar like you've never heard it played before. I don't remember ever having that feeling. Not in recent memory. When I saw Van Halen when I was, in high school, I was wasted and I threw up. I don't think I really appreciated it. But this is different, man. I mean, look, I was sort of a blues head. Slide guitar is not unfamiliar to me. But to hear somebody play it with a type of virtuosity where they take what and they just turn it inside out and make it into something that you've never heard before. I mean, it's a slide, man. But he was doing this Indian-style stuff, and this, his groove and his sense of timing and phrasing is completely original. I couldn't fucking deal. I mean, it's like, because I am judgmental, but, I guess I'm a little cynical or maybe a little, it's not as easy for things to get through if they aren't completely manipulative with me. Or, in my brain somehow just sort of likes to box things or categorize it. But, right when he started playing, I was like, where is this coming from? Do you know what a great feeling that is? And all of them were great. The horns were great. She's amazing. Her singing is amazing. She's a great guitar player. The keyboard guy was great. Gary Clark Jr. before him was awesome. This is weird because it's actually probably would have been a better intro for Thursday. Because Jimmy Vivino, the leader of the Basic Cable Band on Conan O'Brien, also a virtuoso and a behind-the-guy. And I mean that, he's a back guy. He's a background guy. He's a career musician. And he's fucking great. He's going to be on Thursday. So I guess that's a good setup for that show. But I'm going to leave it in this show as a tease, as they call it. A tease. So this article came out in Wired. I'm going to make sure I credit it properly. I think it was by this guy, Nick Stockton, just about how cats feel about us. You are a huge, unpredictable ape, he says. Here's the deal. It's like I've been getting a lot of feedback from vets and from you people about Monkey's issue with his bladder and the possibility of crystals and chronic inflammation, and this happens in male cats, so I bought a fountain that they still don't know what to do with. I'm seeing the fountain now as a meditative backdrop for me when I'm working in the kitchen. The trickling of water is nice for me. I'm going to leave it there. Maybe they'll come around to it. They still can't seem to wrap their brain around moving water, but whatever. The deal is that this article basically says that, look, your cat is a cat and you're just this big, thing in its environment that causes them tremendous amount of stress with your needs and your moods and your attitudes. And I was told that perhaps this urinary thing could be stress, but this article sort of seals it. Just that, there's a lot of things your cats don't like. Cats are, they don't like their tummies rubbed. You think that they do, but they don't. They're just laying on their back because they feel comfortable with you. They don't want you to grab their stomach. I don't know that. My moods affect Monkey. My cats are constantly tweaked out, and I've talked about this before, and this is not unlike anybody else who's in my life, on a regular basis. Eventually, everybody in my life who gets close to me has some sort of, eventually gets into some kind of, skittish state. Like, what's going to happen? What's he going to get mad about? It's a little better, I think, but I think I'm going to have to learn a lesson here from this. I'm going to have to learn a lesson about cats and about people and about keeping my, just relax. I'm relaxing right now. I'm relaxing. So Dr. Drew Pinsky, I'm going to talk to him a little bit about health. I'm going to talk to him about his place in the cultural universe. I'm going to talk to him about, being who he is. Dr. Drew pulls out a lot of different attitudes. I mean, some people, I mentioned Dr. Drew, they're like, I love that guy. Other people are like, ugh, fucking that guy. So I hope you enjoy this interview I did with him. I did. That's it. Let's talk to Dr. Drew. We've got Warby Parker sponsoring today's episode of WTF. Warby Parker is the new way to shop for eyewear. It's the company that was founded with a rebellious spirit and a lofty objective to create boutique-quality, classically crafted eyewear at an impossibly low price. This is the best selection of vintage-inspired glasses, and they're all available to you online. Warby Parker doesn't want you to have to choose between getting new glasses and getting the new iPhone because they're both so expensive. Good glasses shouldn't be cost prohibitive. Warby Parker's prescription lenses start at $95 and their titanium collection starts at $145. That includes prescription lenses. And I buy fancy glasses, and this is a bargain. Their home try-on program is great. Order 5 pairs of glasses shipped directly to you. Try them on in the comfort of your own home and get feedback from friends, family, and colleagues. Keep the frames for 5 days and then send them back using the prepaid return shipping label. There's no obligation to purchase, and it's easy. If you need glasses, you need Warby Parker. Ordering your glasses online today at warbyparker.com/WTF, and you'll receive free expedited 3-day air shipping. That's warbyparker.com/WTF. Do it up. Do it. Do it. You're a pro at this. You know the story. You've done the radio.
Done radio.
Look at you, even set yourself up at the mic properly. Dr. Drew Pinsky. Now, look, I'm going to start off by saying that I've got some problems. I'd like to speak to you as an internist.
Fair enough. Let's do it.
Yeah? Okay, so if I come in here...
I love practicing that muscle. It's good.
Yeah, I mean, that's what you started with, right?
Absolutely. I've practiced medicine for over 30 years.
But, like, when you got into it, an internist is most general practitioners are internists.
These days, yeah.
Right.
My dad was a family practitioner.
Which is different?
Which is a different training. They still do surgery, and they do pediatrics, and they do deliveries and stuff like that. They used to.
Minor surgery.
They'll assist in surgery, in major surgery. I got zero surgical skills. Zero.
But that's
I'm not interested.
But that's a whole another few years of college, right? That's
family practice?
No, I mean surgery.
It's just different. It's a different path.
Oh, you focus.
Yeah, so my thing is cardiology, nephrology, neurology, pulmonology. We do all those rotations, and then we just stop at a certain point and don't go on into a subspecialty like cardiology, something like that.
Right.
And I couldn't give up all the other shit. I was too into it. And then I ended up running a department of medicine in a psychiatric hospital. And that started to fascinate me. And so I sort of became an expert on the interface of medicine and mind.
So as an internist, you were like the on-site medical doctor.
Exactly. Everyone that came in needed a medical clearance.
Sure.
Because you'd be shocked how often medical problems present with psychiatric symptoms.
I'm the king of that.
No, I don't mean somatic symptoms. I mean that literally the depression or the psychosis or the altered mental status is actually because of a medical problem.
Really?
Yeah, and it's
like
not
what?
psychiatric. You name it. If you look at the manual for psychiatric diagnoses, at the bottom of every set of criteria, it says, provided these criteria apply, provided that you've ruled out any medical problem that could cause this.
That's tricky, though,
Person's
isn't it?
not on drugs
Right.
and they're not in withdrawal.
Right.
Because those three things can masquerade as anything.
No, right. But you're saying that they could come in and some of their underlying issues that they were medicating even initially were physical issues.
That's an even more complex thing. Yes, true.
All right, let's get to me real quick.
All right,
so I went to a neurologist. Here are my symptoms. Now, I'll give you. Let me give you my basic profile. I've been sober almost 15 years.
Age?
50.
Meds?
No meds, except for a compulsive use of nicotine lozenges.
Got it.
And massive amounts of coffee. Massive.
Yeah.
That's it.
Okay.
So my symptoms are this. I've been having sort of weird numbness and tingling in my hands and feet that now has manifested itself as almost like pain in the morning. I wake up as if I've been clapping my hands.
Both hands and both feet, or
Yes,
just hands?
right. The hands and feet.
Hands and feet.
Okay, so now I just got a physical. My cholesterol's a little high, but all the other vitals are good.
Okay.
Heartbeat is good.
Previous medical problems?
No previous medical problems.
Surgeries?
Had basal cell removed. Had an appendectomy when I was 11.
Got it.
So this is going on. Now, I've been in and out of anxiety symptoms.
Okay.
I've had tinglies
Just
before.
do something real quick.
What?
Anything around your mouth at all?
No.
Okay. Vision or change, anything like that? Does this do anything to you?
Oh, yeah. It sends a little thing down my middle
There
finger.
you go. That's
All right.
it.
That's good, though.
That's your diagnosis. Yeah.
What? What is my diagnosis?
Keep going.
All right, so I go to...
That's at least part of your diagnosis.
Now, here's the other thing. Now, this started happening. Like, my ears started popping. I started feeling a little pressure in my head, so I got hung up on that. So I'm thinking brain tumor, like on my nervous thing.
Got it.
Everything, because I connect. I don't know anything about it. So
Yeah.
I go to a neurologist finally, because I annoyed my
Well, let me
GP.
see what I can do before I get the neurological opinion, okay?
Sure.
Okay. So you have what's called a positive Tunnel sign, which is consistent with carpal tunnel syndrome.
No, he said that.
Hold on.
right.
Hold on. So you have that. I mean, but a lot of people have that. It doesn't necessarily mean anything. What concerns me is that it should be limited to your hands if
Right.
you had just carpal. And this business, shaking the hands, that's classic carpal tunnel syndromes.
The ache?
The aches, the pain, and the shaking and clapping.
I
kind
don't
of thing.
do that, but it just feels like that sensation right now.
I understand.
Okay, all right.
But it shouldn't include your feet. I mean, there's nothing that should go on your feet. So it makes me think, ooh, with positive Tunnels, feet and hands. How's your thyroid? Have you had any thyroid check?
No, I did not have a thyroid check.
Because hypothyroidism can cause nerve issues like that thickening of the sheaths here and in your feet at the same time. So you want to make sure you're not hypothyroid. I'm looking at your thyroid. I don't see a goiter or anything. And so that's one thing to rule out, hypothyroidism.
So that might be hypothyroid.
It's just something to rule out.
But who would diagnose that?
It's so easy.
A neurologist.
Just get a TSH.
No, but-
Neurologist should think of that. Should be thinking of that.
This was an old guy. He looked like he'd been doing neurology for a while. He did my reflexes. He checked everything. He said, no neuropathy, no neuropathy.
Okay.
But when I told him about the ears popping, he said, let's get an MRI.
Right.
Got the MRI.
It's hard to see a neurologist without getting an MRI of the brain. Because
Right.
anything at all can present in there. So,
Right. So I got the MRI with and without the injection
contrast,
of stuff.
and
And he said, normal brain for a guy my age, he said,
Ooh.
which I took as was an insult.
I would too. I hate that shit. I hate it. Because we have shrinking brains as we age.
Yeah,
so
well,
he's saying that there's a normal amount of shrinkage.
Yeah, I
which,
know.
I'm sorry. That would drive me insane.
Well, what? How's your brain?
I'm sure there's a little shrinkage. I've been obsessing about that last couple of days. I've been I chronically listen to iTunes lectures, iTunes U.
Yeah.
And I listen to medical and psychiatric and psychological and philosophy and history and stuff too.
Yeah.
But lately I've been listening to how to rule out dementias and minimal cognitive change and what's normal change with age. I hate that.
So you're obsessive.
Oh yeah,
Completely. So you're saying I might have hyperthyroid. That's what.
That's one thing to rule out. Yeah,
but
thyroid.
it's not. It's
Then
not.
the physical, they should have done a TSH as part of your thing.
What?
They should have done a thyroid stimulating hormone as part of your physical. Back, you said you had a physical.
Yeah, maybe they did.
Maybe they did. So check that.
So if that's normal, then what is it?
Nothing.
Nothing.
It's one of them things. But you have a little carpal tunnel. You do. I mean, I don't care what he says.
I play guitar, and
you have a little carpal tunnel. Why would it include your feet and stuff? I don't know. But,
Yeah, I don't.
You can get a tarsal.
But
tunnel
what
too.
about the ear thing?
That's the anxiety.
What?
That's nothing.
Are you serious?
Do you fly a lot?
Yeah.
Okay.
Come on, there's got to be something wrong, Drew.
Hey, dude, I just went through prostate cancer this year.
You had it?
Yeah. I had a big operation 6 months, almost a year ago.
How much did they take out?
Everything.
Really?
Yeah.
Can you still feel when you come?
Yeah, but nothing comes out.
But that's it? That's the only...
that's the only symptom. Everything else normal.
You can feel it just... It still provides the same amount of relief and excitement?
Normal. Everything's normal. But I'll tell you what, I was in... It's a case in point,
Yeah.
Guys our age need to get PSAs, need to get the digital rectal exam.
Yeah.
You need to do it.
Yeah.
My story is I wasn't even... I had an illness. I had like a severe... I got H1N1 back when that was going around.
The flu?
Yeah, knocked the shit out of me. And my wife's like, "You got sicker than you should have. Something's wrong with you. Something's wrong."
Really?
With you.
She said that? She a doctor?
No.
Oh.
And I'm like, oh, I had an infectious disease guy treat me. I always call my friends to,
That's the great thing about being a doctor. I think that's why people are being why people are doctors. You grew up with that. It's a unique. My dad was a doctor too. It's a unique upbringing.
What kind of doctor was he?
Orthopedic surgeon.
Yeah.
Kicks your ass.
There's he's better life than an internist. Internist right now, it's almost impossible to be an internist right now.
Why? Because there's that dime a dozen, no work?
No, too much work, and we're being squeezed to a point where you can't afford to run your practice.
Because of insurance and HMOs?
Insurance and HMOs. And
that was his big thing.
Yeah, it's bad.
And you can't practice the kind of medicine you want.
No.
Because
that's been a long time, but you can't practice medicine,
because you're limited by the amount of tests you can do, how quickly they want people out.
Yeah, and what you get reimbursed. I mean, everything's held constant, and you can't... everyone is struggling.
All right, so you're sicker than you should be on this page.
So I got sick, and she goes, "Oh, so you got to need a physical." I'm like, "Dude, I'm an internist. Relax. I got it covered. It's the best infectious these guys just treated me. Get a physical." I went in. My PSA had gone from like 1.8 to 4. Still normal,
right?
And I'm like, and my guy, is a friend of mine, goes, "Oh, we got to see a urologist." I'm like, "No, oh, come on. Just because I'm a doctor, you're nervous. See the urologist." The urologist goes, "Something doesn't feel right. Something to look like. It's probably prostatitis. Let's treat you for prostatitis." Got treated for like.
Had you had that before?
Yeah. Get treated. That's fun too, huh?
I had that before.
Isn't that fun?
Yeah.
And I got treated for a month, and they like, "Still up. Got to do an ultrasound. Got to do a biopsy. Biopsy, cancer." Couldn't believe it. God damn. But there was a great case in point with 3 people using their instincts, which is really an important point that's left out of medicine entirely now, which is these guys, by the book, I should have not been diagnosed. I should have not been biopsied. I should have not even gone to see the doctor in the first place. But 3 people had good instincts that something was up. Then I got followed for 2 or 3 years with serial biopsies because it was low grade and you can watch for a while. It's not
for 3 years.
2 years.
You had the cancer.
Yeah,
and you were going to just manage it.
Just watch it. Yeah.
Why would you do that? You're not as reactionary as you should be as a doctor.
30% of the time it gets better. 30% of the time it stays the same.
Oh, I see.
It's low grade. We don't really know what to do with the guys like me, low grade prostate.
So you didn't find cancer cells.
Oh yeah, there was cancer, but low grade.
Sometimes that goes away.
Sometimes it regresses. Yeah, gets better. But you watch it. And the point was, it kind of the volume was more than it should be. So again, another instinct. My guy was following me. Went, "I think we got to go.
Just take it out."
And lo and behold, there was a piece heading for Mecca. There was a little tributary going out towards the
You
capsule.
saw that when you got out.
I'm going to take it out. It's a big operation. It's a big deal. It laid me up for months.
Oh God.
Yeah, it's a big deal.
I would imagine. You wear a diaper, right?
Well, no. I went back to work in a week.
Not now, but
no.
I mean when you
you have a catheter for a week. It's good times.
Yeah. All right. So let's going back to.
So you're good.
I feel all right. What, prostate wise?
Yeah.
Yeah. I think I'm fine.
You're good always. But coming from a medical family, you're more prone to somatizing. That's true. That's
of course
it
is. How else are you going to get your dad to pay attention to you?
Well, there was something going on around Facebook, like 11 things that only family members of doctors know.
Yeah.
And one of them was, no matter, you can't get their attention no matter how sick you are. Everything's nothing.
Everything's nothing, but they'll tell you that.
Except when you do get their attention, it's cancer. You know what I mean? We freak. I do exactly that with my kids. So, I go, it's nothing. Don't worry about it. And then when it gets into my consciousness, I'm like,
or if they keep pushing.
Yeah, I'm like, oh crap. It could be cancer. It could be this. Could be that.
Why am I trivializing this? But you grew up right here?
Pasadena.
That's where you grew up?
Yeah.
Down the street?
Not far.
And your dad was what kind of doctor?
Family practice.
So what does that mean? So when you're older than me, so he was probably making house calls. He probably an intimate practice.
Yeah.
Like just people from the neighborhood.
Yeah.
He was everybody's doctor.
Yeah.
Pediatrics as well.
He early did that. Yeah. Then he stopped that later.
And your mom and he was a Jew.
Yeah.
And your mom from where?
Philadelphia.
Not a Jew.
Not a Jew.
Yeah, but you're not a Jew. Are you Jew?
I'm identify a little bit. I'm not a good Jew for sure. My daughter is sort of getting into it. She went on the
She went to Israel?
To Israel, yeah.
Oh, really?
It was very important for her.
So your family identifies as Jewish?
I was in...
Is your wife Jewish?
No. But she kind of. We can't figure it out. There's all kinds of... Because they're people that sort of intermingle and then forsake things, formally along the way. And then she's Czech, big, way Czech. And there was lots of Nazi and communist and problems that way that they couldn't practice.
Some relatives, in order to get out of problems, may have had a sex with a...
or whatever. But I went to Saturday school till I was in 3rd grade.
Okay.
Yeah.
But
so I had an extended family. It was very, very Jewish.
So you grew up, with money over there in Pasadena, in a Craftsman?
No.
Regular house?
Modern.
How many brothers and sisters do you have?
One sister.
And what does she do?
She is a mom.
She marry a doctor?
No, she married a commercial real estate guy.
Oh, all right.
Yeah.
Interesting.
Everyone's getting out.
Yeah. Of medicine?
I mean, fleeing. My kids aren't going to do it.
My dad doesn't practice anymore.
Yeah.
But because
it's heartbreaking. It's heartbreaking.
Well, like what you were just talking about, the idea that you were able, just because of who you are, to have access to 3 doctors to come up with an opinion that saved your life is not everyone's experience.
No.
And it becomes harder and harder with the way the insurance companies and HMOs...
Well, you're not going to see doctors. You're going to see something called physician extenders. I was on CNN the other day, and I said that, and Anderson Cooper goes, "What?" He was like incensed. Physician extenders? I go, yeah, you're going to see physician assistants and nurse practitioners, because A, there aren't going to be enough internists to go around to meet all this, and B, they can't run a practice.
But do you think that maybe, like if you look at the English model, that there was obviously part of the reason you got into medicine was to make a good living? I mean, that was the sort of idea, like when my dad's generation was coming up, be a doctor. And it was not always because so you can help people.
No,
like
they could reliably make a living, yeah.
Right, yeah. So I think that the adjustment that maybe physicians have to make now is that you're more of a civil servant.
Absolutely.
Than you are
what's a little unfair, though, is that there's still guys within medicine making ridiculous, absurd amounts of money. Absurd. And then there are people struggling, trying to make a living, can barely make a living.
Well, I was on an airplane. I flew first class because somebody, flew me out somewhere. And I was overhearing a conversation of this older couple that lives in Malibu. And apparently what I gleaned was that the guy, and they were talking about houses in New York, a house in Spain or whatever. Yeah. But what I gleaned was that this guy was a plastic surgeon who did Michael Jackson's first nose. That he made sure to qualify it. The first nose the
good one.
The good nose.
But isn't it bizarre? I find it bizarre that people will pay those sums of money for cosmetic procedures, but things that actually enhance their health, I want that free.
Yeah,
it's bizarre.
I don't know. Like I've seen my father's plight, and that I thought he was being paranoid. He felt like he was being run out of town and limited by the HMO stipulations on how to treat. He didn't feel like he could treat people the way he wanted to treat them.
Well, doctors made too much money for a long time. That's for sure.
Right.
It was too much. It was too fat. That generation, it was like they spoiled it for everybody else.
So who are these physicians that you say are making a lot of money? The specialists?
Really, the people that have cash businesses, the plastic surgeons.
But you can still have a cash business. Arguably, you do have a cash business in different areas.
No, I don't do. I never made much at all practicing medicine. Really never.
But why'd you get into it?
I had to ask myself along the way. I mean, I was good at it. I always thought I would do it.
Did you do it because your dad did it?
Yeah, I think that's where I started. And in college, I ran away from it for a while. Like, no, not me. I'm doing music. I'm doing this. Became a hipster for about a year and a half.
In undergrad?
Yeah.
What did you do in music?
I sang opera.
Do you still sing opera?
I occasionally.
You sang opera? That's not hipster. That's bizarre.
Well, back then.
Even then, how was opera ever hipster? No one can understand it. You sing in Italian?
Yeah.
That was your passion?
Yeah, for a minute.
What, are you a tenor or a soprano?
Baritone.
A baritone tenor? So you studied opera?
Oh, yeah, for years and years.
For years and years?
Yeah.
Now
I did it as an avocation for a long time afterwards. It was exciting for me.
What do you mean an avocation?
I mean, I did it while I was going to medical school and residency and stuff, too. I kept doing it.
What do you mean you did it? It's not like you can moonlight as an opera singer.
No, I didn't perform. I just had a lesson and a coach. I just do it.
But it's like one of those odd musical sort of passions where it's not like, I'm just going to get together a couple guys, we rented a space.
Not really. If you're a singer, you get tired of everything else pretty quick.
Right.
You start singing classical very, very quickly. You just say, all right, that's too easy.
So what would you do? Put on the music and just sit at home and do it?
Yeah, or get a pianist or practice in my car or just do scales or whatever.
You do scales? Do you do it now?
No.
You don't do it anymore?
My son's a singer and a pianist and stuff.
An opera singer?
Yeah, he does it, yeah. I'm not sure that's what he's going to do, but he does. He's formally trained.
Do you go to the L.A. Opera?
Occasionally. I'm not like deep in it. It was just sort of a fun thing.
Anybody who decides to sing opera is deep in it. You can sing anything.
What?
You could sing anything.
No, I can't. I'm a terrible musician. That's the other thing.
You got to love opera on some level.
I like performing it more than watching it.
Oh. I have a hard time with it.
I can understand that.
I mean, I went to a couple down there, easy ones.
Right. I would say even I like Rigoletto and stuff like that.
Yeah.
I like spaghetti and meatballs.
The thing I love about opera is that, like, you've got your primary players, and then there's like at least 50 people sitting for the last scene. Like, what do those guys do during the day? Like,
I know.
all of a sudden, out of nowhere, like the stage is filled with
and these
people.
are highly trained professionals
Right,
too. I wondered that too. Yeah.
They're just sitting back there.
Yeah.
How do they make a living?
I know. My son had to address all that. He's like, I don't see this. I don't know how it works. They teach, I guess. They teach.
Waiting around for the last song.
Yeah. Isn't that crazy?
It is crazy.
I guess at one time they were part of a company and they were sort of supported that way.
All right, so you do opera.
Yeah. So I ran away. I went back to it, and then when I started medical school, it was like, wow, I love this. I really loved it.
But was there any part of it where your dad was like, "Come on, what are you going to do?"
Oh, sure. You
got along all right with that guy?
Yeah. But that was awful. That I don't try not to apply. I try not to directly apply pressure.
But you got pressure.
Oh yeah.
Yeah.
And but once I sort of made it my own, I really went back hard and loved it. And as I went along, like during your clinical rotations, I was like, I'll be a neurosurgeon. I'll be a gynecologist. Every rotation, I was like, I love this. And then my last rotation, third year, was in medicine. I went, oh shit, of course, that's why I'm doing this. That's why I just want to be a doctor. I don't want to be a big superstar. I don't want to be a surgeon. Just want to be a doctor.
So the specialist enables you to engage your brain in a different way. I mean, what you did was broader. And you can sort of kind of.
I love humans.
Troubleshoot.
No. You got to understand something. I really like humans. I love the human experience. I love all aspects of it. And I had trouble letting go of things that I understood better now. And instead of letting go, I sort of expanded over into the psychiatric side, which was like the interface of all these things, all of the family, the relationships, the brain, which I studied brain a lot in college, and that sort of was a natural place for me.
Because of troubles with your own brain? Were you like?
I was in therapy for a long, long time.
In classic therapy with a psychiatrist?
No, she was a psychologist.
When you were younger?
I finished. My son had brain surgery when he was 1. And my anxiety disorder got so profound after
so it was
that.
anxiety
again, my wife
issue.
sent me again. Oh, yeah. And I went for 11 years. It was fantastic.
About anxiety?
About anxiety. It was about accessing affect and regulating it, if that makes sense. But
so tracking the source of your panic.
No, the panic was all epiphenomenon as far as I'm concerned.
What does that mean? Reasonable?
No, just symptoms of something unrelated. This is sort of how I got involved in addiction stuff too, because I think people really need this kind of stuff deeply.
Right. Do you go in there? You're anxious. Your kid had
anxious,
and full of dread.
Everything. Yeah. Anxiety is about the only feeling I had for many years.
Oh.
Yeah. And finally, she was like realizing that I think I might have hit. She would never she had careful boundaries, so she never really told me. But I think I had kind of an alexithymia where I couldn't access and name feelings very well. And so
what's that called?
Alexithymia. And so
that's a psychological condition, it's not a medical problem, right?
I mean, yeah.
Okay. So,
but it created a psychiatric syndrome, panic and anxiety. Yeah.
Right.
And so by learning to sit with another person and deeply connect and let her sort of help me attach, then it was profound. It was profound.
A lot of crying?
No, a lot of dissociating. A lot of disconnecting, because I had sort of dissociated.
Once you connected, didn't you just?
No, I think what happened to me was because I never had problems with intense feelings. As usual, intense feelings.
Screaming or crying?
Yeah, intense feelings are all right.
Yeah.
But as usual, it's the intermediate zone that people have trouble with. And I would feel comfortable, I guess, or safe, sort of dropping into these dissociative states that I didn't even know I had.
How would that manifest itself?
I would fugue. I would and time would expand and contract. And I have no idea. And she'd all of a sudden become aware, and she'd go, "Time's up." I'm like, huh?
Yeah. Oh, you just left.
I'd sort of hypnotic.
Right.
And I think that was the source of my anxiety. It's a guy named Alan Shore that calls those trauma-associated dead spots. And it would fill in as I would get more comfortable, sort of moving in and out of it.
What was the source of the trauma?
That's sort of emotional abuse when I was growing up. I don't want to, out anybody, but
like anger type. Or selfish type? Like were you neglected or were you used?
Used.
Abused.
Used.
Yeah.
For sure.
Yeah. Narcissistic parents. So we have similar things, you and I.
Yeah.
It's weird like that because that's tricky, isn't it?
It's delicate and it's submerged and it's not obvious.
But, it reveals itself in me through codependent behavior.
Absolutely, me too, 100%. Because you end up, your whole being becomes about managing them. And, and they demand that.
Right, and you had no choice early on.
Well, you didn't know. Nobody gave you enough of what you needed to develop an autonomous self.
Right, but the narcissist, exactly.
Yeah.
But the narcissist thinks that they're doing it right.
Oh, absolutely. They're doing it for you.
Yeah.
They're doing it for you.
Oh, it's so sad. It makes me choke up. So but that is really the key to it is that, so you had that too.
Yeah.
That's a scary thing. So you like, because what I've realized about myself is that you wander through the world with an incomplete self because you were never
100%.
Right, because you weren't able, no one drew the boundary. Apparently
no one drew the boundary and then sat there and was present for you. Ever.
Right.
Because they didn't know how to. They didn't know how to.
And they still don't. Mine don't.
No, absolutely not. No.
And no matter what you do.
They would like be confused.
Yeah, they're like, what are you talking about? We took care of you. We bought you that car.
Yeah.
You remember when you were 15?
Yeah. And you were tough. You were brooding and anxious. And you were tough. You were like every teenager.
Right. But you had it together.
Look at you. You're fine.
Look at you. You're fine. Yeah. Well, I mean, but I don't know how you didn't get more fucked up. I guess you.
I think I gritted it out. I ground it out for many, many years dealing with my anxiety stuff.
But you must have been obsessive. I mean, you must have overworked.
But I liked. Oh yeah. Oh my God, I had severe workaholism for many, many years.
So that was the thing.
Yeah. But I liked people and I could connect to people. I just couldn't connect them in a real genuine way. I remember telling my therapist,
because there's a fear there. Right? I mean, like, the weird thing about me is that if you let yourself be vulnerable, because, you emotionally,
you're exploited.
Right, and no one placated this fear of being hurt thing, or your sensitivity is not relative to the situation.
Yeah,
everything becomes very big.
Yes,
like if somebody just goes, "I can't have lunch," it's like, what?
Yeah, what did I do?
And it's like, God, I'm an asshole.
well, listen, I had a little different thing. I remember early on in therapy, I said, I really see this whole process as the search for the genuine.
Right.
I want a genuine.
That's what this whole podcast is.
I want a genuine emotion. I want a genuine connection.
I want to be authentic self.
Authentic self. And it was empty. A lot of emptiness I had. And empty is a common feeling these days. So that has kind of become, strangely enough, Mark, my life work now, trying to help other people see it because it's everywhere.
The emptiness.
The emptiness is so common now, and it's emptiness because of abuse, because of narcissistic parenting, all that stuff.
Narcissistic
abandonment,
culture.
Neglect. It's everywhere.
No, I get it.
Yeah.
And you're like, not unlike what I'm doing in certain ways is that, to get back to that. Because, just because we happen to have narcissistic residual syndrome, which I just made up.
I love it.
Being brought up by narcissists, we have a sensitivity to it, but we're cursed with the self-awareness to not be narcissists. So then the struggle becomes, well, who am I? And then, once you sort of level up on that, it doesn't mean you know what the hell to do with that. I mean, I still deal with emptiness. I mean, I can't make a relationship work. When I stop working, or I sit there and I go, well, what am I going to do now? I don't fucking know. Nap. I can't. I still have a lot of anxiety.
Yeah.
What do you do with the emptiness now?
I don't experience it anymore.
Well, how do you know you're not just a workaholic?
Because I actually worry that I'm not working enough anymore. Okay. I love work. I have, because of therapy, I've organized my life in such a way that all parts of myself are involved and things I do are sort of creative and interesting. I get to come talk. Are you kidding? 20 years ago, to have time to do this?
Wouldn't happen.
No way.
I have had many cyclical, I'm me, you're you, fuck you things with my dad because of this thing.
Yeah.
And not knowing, ultimately, there's still some party that thinks they're going to take responsibility for it, but usually they retreat into something.
No, they've got what they got. They can't change unless they go to treatment.
But you always accepted that?
My dad passed away. And so that was that. And his stuff.
I'm sorry. When was that?
Oh, it's 4 years ago.
Yeah, I know, but you're 50-something years old. So what happened before that?
What happened to me was with him. I still got stuff with my mom.
Is she around still?
Yeah. With him, he was doing such a wonderful job as a grandparent. He was just like.
You let him off the hook.
Completely. I was so grateful. I was so filled with gratitude for his grandparenting that I was like, I'm out. It's fine. I don't care anymore.
That must have been moving, though.
Yeah, that was intense. That was important.
Yeah.
And I would give anything to have one more conversation with him. I know a lot of people feel that way. But Yeah,
So that
I found
resolved
forgiveness.
itself.
I found forgiveness and gratitude in that. Absolutely.
Well, when did you know that you had arrived at your true self, or that you were being authentic?
It just a long process. It just happened. I noticed I was using it more in treating patients. I think that's when I had something more to offer patients, and I could offer them a real empathy that was profound.
That's what you see. That's what people don't realize about people that come from what we come from. When you come from narcissists, your capacity for empathy has to be learned. And it's kind of fucked up.
But there's also an asset there. It's not because you're so used to, some people. I think there's two sort of wirings in people: people that start in and go out towards others, and people that start with the other and then go in.
Right.
And to some extent, we all do both. But codependents go out first. And so we are exquisitely sensitive to. We can pick up.
But
on
I'm
what's
a closet. The weird thing is I never knew that part of myself. My second marriage dissolved because she went to Al-Anon, so she hit a codependent wall. But I didn't see my part of being a codependent until recently in recent relationships. I didn't realize that there was such a thing as an alpha doormat.
It's got to. I have a special empathy for co's that are addicts. That's a tough combo.
Yeah, because you're the monster.
It cuts both ways.
Yeah, and then when at 15 years, I'm in two relationships where I'm clearly chasing my ass to try to accommodate. And I'm like, oh my God, this is even more powerful. But it's more power. It's like I never understood what that dynamic was. And and I had it all my life because when you deal with erratic parents who need managing, you accommodate.
And there's another layer to it too.
Oh boy,
this is the crazy part.
Yeah,
is that, and this you can't really ever cure. You're going to be attracted to people that put you in that position.
I know.
and you just love them. That's just how you're wired. It's your love map. And you've got to mitigate it. The way to mitigate it is to go ahead and go after people you're not that excited about. But then you're sort of withholding something from yourself.
But you can't do that because then it's like it's like a phantom limb.
It's hard. It's very. And by the way, you can also just go for people that are exciting, but realize it's going to be dramatic, and you can need a lot of therapy.
But that's the thing is that what I learned is, or what my therapist says, that's the way it's going to be, and the best you can hope for is that they're willing to do the work.
Yes. I agree with that.
Yeah.
There's very, very few therapists would say that. I think you are seeing somebody good after all. So I absolutely agree with that. Because that's life.
Well,
we're not perfect. We're not healthy all the time.
That's right. But
it's what makes life interesting.
You can't be with somebody that's going to have that you're not going to connect with on that level.
Well,
and just say
you can, but
you better be very disciplined not to go out and fuck the lunatic.
Correct.
Correct. Yes, of course. I live this.
A lot of people do not understand this. And it's where a lot of the craziness comes from. The things that were traumatic in our childhood are the sources of attraction. And no one writes,
not only the source of attraction, you want to recreate it.
Well, that's the conscious experience of it. I think there's something far more
unconscious.
profound.
I think that
because when people start talking about it in therapy, they always go, well, I guess I wanted to master it. I want to make it right this time. Like, no, that's your brain trying to make sense of bullshit motivation.
No, it's comfortable. It's what you grew up with.
It's your
map.
Home. It's love.
Right.
It's your map. It's where you find love.
Is it love?
Yes. That's your version of love.
Not
the healthiest version. Not the healthiest version. But I got the same one, so it's all good.
But you've been with your wife for how long?
23 years.
So
it's working. We have our craziness, but we therapy here, everybody, it's good.
All right.
And I have found in the craziness passion and renewal.
Right.
It works for us. I now hope it keeps
my problem now, because I've dissolved 2 marriages and I just got out of a relationship that got crazy, and now when I meet somebody and I feel compelled and they seem normal, I'm like, I gotta wait.
Yeah.
No. Like,
if something's gonna happen if you're attracted.
Right. I'm like, what are you hiding?
It's in there. If you're attracted, of course,
it's in there.
Of course. However,
yeah,
you've been doing a lot of therapy and stuff like that, and it's possible that if you notice yourself being attracted to people and surprised you're attracted to that person, that might be somebody safer.
We'll see. The one benefit is I've gotten out of things quicker, So
you end up you see it. Yeah.
Well, yeah, but the pain of that, all of that, the heartbreak.
It's funny. I'm sighing a lot here with you. I feel
there's a heartbreak to things I
totally get it.
It's going to be different. All right, so I want. There's a couple things I want to ask. Okay, so now you're the.
So first, did we finish your medical stuff?
Almost.
Right.
It'll come back.
Right.
No, the basic medical stuff, but psychological stuff might still need work. What? But you're not a psychologist.
No. That's why I'm moaning. I'm like, people want me to do all that stuff, and I have a familiarity with it. I like people. And I like their issues.
But don't you get flack for that? You're not a psychiatrist. You're not a psychologist. You get flack for a lot of shit. Some people don't like you.
Oh, I know. I get flack for a lot of shit. It drives me. It's painful.
It must be painful, but I mean, well, you can answer to it later.
Sure.
But so let's
do it now.
Well, I will.
Yeah.
But so your inspiration for the way you built your practice, outside of television and everything else, was being this in-house physician at a drug facility.
I had two jobs, basically. One was my general medical practice.
Where you were seeing people with my stomach hurts. How come this happens? Right.
That's in old people sick.
And you were doing okay?
Yeah.
Okay.
Yeah. And then I got and I was doing the drug and alcohol thing. I was running the drug and alcohol
once a week or?
Oh no, that was a daily thing. But I had a partner. I was.
But you got hired on by the people that put the place together, right?
It's more complicated.
Okay,
I was there. I started there when I was doing the medical workups, moonlighting as a resident. Then I ended up taking over their medical services.
Okay.
Ran those for about 4 or 5 years, and then was asked. All the sick people were down at the drug unit, so I got very good at detoxing people. The short story is the guy that was the director of the program goes, "Hey, help me out here. I need an assistant director, so when I'm away, someone's watching the shop. Don't worry, there's nothing to it."
You got good at pulling people off opiates?
I got really good at it. I could detox anybody, anytime. It's no big deal. We can do it without using opiates, without Suboxone, without methadone, without all this stuff. So I'm deeply connected to abstinence-based treatment. I've seen it change lives, and I think it's a shame when we shortcut it. Anyway, so the director asked me to be the assistant director, and then he quit, and now move up to the director, and I was like, oh crap.
Yeah.
So I had to really become an expert fast, and spent 20 years doing that. Now towards the end, my partner was doing a lot of the work, and I was just sort of supervising.
But initially it was starting off dealing with the medical issues of coming off drugs.
Right, and then all of a sudden I was in the middle of it. I had to become an expert on recovery, on the family issues, on interpersonal.
And you read the books.
And I've retaken the board, so I'm officially an expert in this.
Because you know what fucking gets me is that you go see a therapist, and in my mind, any therapist, read the fucking big book.
I know.
Wait, but what the? I mean, just.
But it's so complicated.
What do you mean it's complicated?
The lack of the politics and the philosophies that are wound into the treatment of drug addicts. It's unbelievable. I literally feel, and I find this bizarre. I one time, I told a story the other day to a group of psychologists. I was concerned that all my patients, we detox them, we treat them, we get them in treatment, and all of a sudden they'd end up in another part of the psychiatric hospital on benzos, on opiates, and we go, look. We've been working with this guy for 6 months. We're doing great. You brought him in, and just because he said he was suicidal or anxious, you put him on the drug. Please understand, this guy was using, and you didn't test for that. And I said, I'll tell you what I want. In the admissions office at the hospital, I just want a banner above the people doing the admissions. Reminder, all diagnostic criteria contingent upon no medical, drug use, or withdrawal. Otherwise, the criteria are invalid. And it was the director of admissions and the medical director looked at me and my nurse and went, like the unenlightened. Like literally we were arguing about religion or something.
Yeah.
It was bizarre. I said, no, that's the criteria. I just want a reminder for the people using these criteria that they're applying them improperly.
Right.
It's no philosophy issue. It's no religion. It's just fact.
Well, but the weird thing is that there is this weird disconnect between, people who medicate.
Yeah.
Practitioners.
Yes.
And people who are cognitive. Right?
Yeah. Oh, yes. For drug addicts,
right? Well, the thing is, I know there's issues about, about treatment, but the truth of the matter is no treatment. Most of them don't work. Most of them, the success rate is shit.
Yeah. True.
So, if somebody says
that's why all this other stuff comes in, because abstinence has such high recidivism. The other stuff, if we had great success with abstinence treatment, there would be no room for anybody else.
Right, but the other thing is just then it becomes a question of the disposition of the person, making somebody taking them from drug addiction to a more acceptable drug addiction.
The question is, are you going to try to get this person into a flourishing life or make them chronically ill? That's the thing. And if they're going to die if they're not chronically ill, okay, we'll make chronically ill. But who do we make chronically ill? That's the question.
What do you mean by chronically ill?
Like chronically on medication, chronically not flourishing. Because recovery is about flourishing, about being better than you ever knew you could be.
Right, I know. But then when you talk about that, and then you talk about your own struggle about being hobbled, psychologically, and realizing that a lifetime is only a lifetime, and that what is necessary to sort of really parse what is going on with you and behave properly. I mean, you can act as if all you want, but eventually it'll stick somehow or another. But you're still going to deal with those feelings. But it takes a certain amount of courage and persistence.
It's not for everybody
to do it.
It's not for everybody. But so the question is, how do you select?
I don't know.
The interesting, well, here's the interesting selection. Magically, doctors all get abstinence treatment. So for our peers, we only use abstinence treatment.
You mean in the community?
No, I mean, if a doctor gets addiction, the only acceptable treatment is abstinence-based treatment.
Right.
Interesting.
Yeah.
For us, that's the only acceptable treatment. But for everybody else, well, we have other options for you. It's like,
What, you mean like medication?
like medication and whatever.
But sometimes medication is appropriate. There's plenty of doctors on medicine.
Opiates and benzos is what I'm talking about.
Okay.
Yeah.
Are you on medicine?
No. Oh, well, I have cholesterol and blood pressure medicine. That's it.
All right. So what now, I guess most of the criticism around you is that you're an opportunist who's, exploiting the addicted.
So help me understand what that means. Because that's where I start. Like, exactly what does that mean?
Look, I've maybe watched only a couple episodes of your show. I've listened, I know you as a person. I've met you a few times. I've listened to Loveline here and there. I've watched one or two. I've not been, committed. I don't do a lot of research, but I think the idea is that reality shows in general are exploitive, and that reality shows that are presenting themselves, not unlike many of them, there's a certain type of reality show that presents itself as helping people. But, when there are tragedies within it, or when people think that storylines are being extended, or drama is encouraged in order to make the show compelling, then it seems exploitive.
And you would also think that the people who are being exploited would, feel exploited?
Right.
And not...
No, I don't know. It's tricky with celebrities.
Yeah.
Because that might be part of the problem, right?
Well, so here's the situation. So let's look at the situation. And I understand the criticism. I do. So I would think exploited would mean somebody is unwittingly brought into something that they don't understand, and then and their well-being or their good is sort of forsaken for something else.
Right.
So and by the way, I didn't dream up doing this thing. Somebody asked me to do it, and I thought...
Celebrity Rehab.
Yeah. I thought, no way. Forget it. But I started getting convinced to do it. And actually, it's Bob Forrest that convinced me to do it. He came to my office one day, and he said, he goes, I'm so goddamn sick and tired. We treated a lot of celebrities back in the day. I'm so sick.
Privately.
Yeah, without anybody knowing. So I'm so sick and tired of our patients being disdained in the media as being on some sort of spa vacation or on a publicity campaign. People are sick. They do hard work. We got to do a TV show where we show what these people do. Out of the blue, he said this to me. Somebody already approached me at that point about it, where we do a TV show where we show how hard this work is and how sick these people are and what they need to do to get well. And it's interesting that I just been approached about this. If you think we should, I'll keep going.
And he's somebody you work with at the treatment center.
I've been working with him for years and years. In fact, I knew him back when he was a severe drug addict, and I thought for sure he died. For sure.
What was his band? Was it
Thelonious Monster?
Yeah. I see him around. I mean, he's a guy. He's solid. He's got double. What does he need? 20 years sober now, or something more?
Yeah. I mean, he was treated over 20 times. And severe addiction.
So this is interesting. So because of the cultural perception of celebrity and the need for predatory tabloid information about them, Bob thought that they were being mischaracterized and treated poorly.
Yeah.
Because of people's lack of understanding of how difficult the job is and what drug addiction is.
Right. And this time we did a TV show, we showed all this. We really tried to educate people about it. I think we achieved that end. I think that's what we intended to do. Well, what I didn't know was, is this going to be good for these patients? I had no idea. And I was very, very concerned about that. And because of that, the consent process was extensive. They needed to talk to their family. They needed to talk to everybody. And two things kind of happened that were sort of surprising to me. One was when we treated the first, and all we did was treat. In fact, at the end, as I learned how these people do these reality shows, I got to the point where people were not allowed to make even eye contact with the patients, and they were not allowed to make eye contact with me unless they had 4 questions. Doctor, how's the patient doing? How long are they going to be in treatment? How much is it going to cost? What's the aftercare plan? That's it.
Yeah.
Those are the only things they're allowed to talk to me about. And if they talked about anything else, I'd leave that goddamn set. I swear to Christ.
Yeah.
But I didn't know I needed to be like that at the beginning. So that's how you have to be when people...
With who? With these questions?
With producers. They want to monkey with people.
Right.
You can't do that with
the
sick
reality
people.
producers.
Yes, they wanted to monkey. I was like, these are sick people. Are you kidding me? So.
But you didn't do that initially until you learned...
it took me a little while to learn.
That they were predatory.
Or whatever they're doing. They don't understand.
Exploitive.
Forgive them, they know not what they do.
All right, well, that's very diplomatic. Okay.
So the first thing was, every time we'd get in every day, I go, are you okay? Are you okay? The camera's okay? Are they bothering you? everyone's like, no, fine, the cameras don't bother me. And finally, Mary Carey, the porn star, leans into me and she goes, Drew, I've done just about everything in front of a camera. This is not a problem. I thought, okay, I get it. So that, and then the other thing, and this was the big surprise and the great relief for me, is that every single patient had an evolution in treatment that we didn't expect. They went from coming in because they wanted to be on TV, they want to make money, maybe I'll get a little treatment, whatever.
Bounce back.
Whatever, come back. Whatever. Their motivation was not necessarily strictly to get over drug addict, get well. They went from that to realizing we were serious. Most of them came in to screw with us, too. They wanted to mess with our production, mess with me. A lot of people intended to sort of make a name for themselves by screwing everything up.
Right.
They understood we were serious about it. They started valuing their treatment. And they ended up, pretty much every patient ended up wanting to share it with other people because they valued what they'd gotten in treatment.
Right.
And that was good. That was good. The problem is, once they leave treatment, how do you know who's going to keep going and who's not? And that's where
with anybody.
With anybody. And I made myself, I treated anybody who wanted treatment, we got it for them.
It's kept it going. People do not fucking understand the heartbreak of the thing.
Oh,
like
so difficult.
Well, culturally, there's really two camps. There's tough love, pull yourself up by your bootstraps, and then there's people who live with it on some form or another, either within them or within family members, who realize this struggle is not that easy, and it does not imply weakness. I mean, there are some people that can just say no and drive drunk the rest of their life.
Rare.
It is.
Yeah, I wouldn't bank on that for anybody, by the way.
Yeah, but some people
do.
Some people will have periods.
Yep.
Where that was a bad time.
Yep.
And I'm done.
Yep.
And then but I wonder what the statistics are, and what are they replacing it with?
Right. What's next? Absolutely.
Where's that?
Well, either that or they're not an addict.
Well, what do you?
Because that happens too. People do substances that are not addicts. Yeah.
No, of course, and I hate them.
Yeah. You wish you could be like that.
Yeah.
Right.
But I mean, you were making a good living with that thing, right? I mean, that was your primary thing. Love Lines was different. That's interesting. Like, how did you come into that? I mean,
it's a long story. It was just accident. I thought I was doing community service. That was back when I was in medical school.
But that made you in Corolla, right?
Well,
publicly,
Corolla came like 15 years later. I was in radio. What got me into radio was HIV and AIDS. I thought we needed to talk about this. No one was talking about it.
As an internist.
As an internist. I wanted to get on.
Were you treating AIDS patients?
Oh, like crazy. And they
what
were
year
all
was
dying.
This?
83, 84, 85.
Right there at the beginning.
Oh, yeah. It was horrible. And nobody was talking about it. It drove me insane.
Yeah.
Because there was a general sort of, in the general culture of the time was, well, young people don't have sex, so we don't need to talk to them. That's how people thought. Remember, condoms were behind the counter. You have to go to the pharmacist to get the counter.
Yeah.
That was insane to me. And I thought, we got to talk about this. And so I, once a week, came on and answered questions.
What station was that?
K-Rock.
Oh, it was right at the beginning?
Yeah, right here. And it was when K-Rock was on Los Robles. It was a little shithole above the dentist office or something.
So you're like, Dr. Drew is here to talk to you about sex.
And I didn't use my name. I didn't want people to really know what I was doing. I thought I was doing community service. But
it was about sex. It was that standard fucking issue of how are we in America so fucking repressed and Victorian about how we approach this?
But back then, young people were having lots of sex, and there was nowhere to go for STDs were mysterious. There was no internet. There was no textbook. There was no education in high school.
But there's also shame and fear.
All that stuff was there. But people were having lots of sex, right? Young people.
They're always having lots of sex.
I don't know what it was like in the 50s and 60s, but in the 70s and 80s, it was going on, and no one was talking about it, and no one was talking about healthy ways to do this. And it was all considered sort of taboo, and you don't talk to young people about it, especially.
Right.
I got shit for that, too. And here's the bottom line here, Mark.
Yes,
this is why I'm getting upset. Is that I do stuff that I think instinctively is right, and I think I have pretty good instincts, and I love people, and I want to do what's right.
Yeah.
I do it because I think it's right. I think I was right to go talk to young people about sex. I took more shit about that than probably anything.
What kind of shit, generally?
I had the director of my residency program screaming at me, telling me I was sick, there was something wrong with me, he was going to fire me. I stopped for a while. And same guy,
what
2 years
later.
Sick? There's something wrong with me if you're talking to kids about sex.
Right.
Same guy, 2 years later, I went back, he's sort of on the DL, and then started doing it again. Same guy, 3 years later, comes back to me and goes, because he got involved in AIDS education later. Hey, you still doing that radio show? I'll tell you what, I'll take over now. I got it.
Really?
Same guy.
Yeah. But you were treating people when there were no answers. So you got some of the first cases.
Absolutely. I would say when they came in with their first episode of Pneumocystis, I would say, you have 6 months to live, and I was never wrong. Never wrong.
But you didn't know it was AIDS at that time.
Oh no, we knew what it was then.
That was like one of the major KS,
pneumocystis, CMV retinitis and stuff. We would see all these crazy things, and all leukoencephalopathy. But we knew it was AIDS
because that's what.
I have to say though, there's a piece of the story that people don't know very well. when AZT, County Hospital was doing a lot of the AZT research, and we got AZT, and we're like, oh man, this is working.
Yeah.
The buyers clubs at the time and Spin Magazine, if you look back at it, came out and said, that drug causes AIDS. Don't take it. That's the syndrome. It's the people they're taking advantage of you. Come with us. Get the stuff from Mexico and blah, blah, blah. And I saw hundreds of people die because of that. Now, they would have died anyway at that point in time.
Why would they say that?
I don't know. Go look at old Spin magazines. They did series on it.
I kind of remember.
Yeah, they would say it all came from the Gallo Institute, and it was doctors putting this BS out, and the drugs they're giving you are causing the AIDS. And it was even implied in the Dallas Buyers Club movie. They sort of implied that, well, remember, the guy took tons of it too much, and he got sick. And then it sort of became the doctors made people sick too, but then they didn't. Look, we were rushing to save lives. I mean, It was so
you had to do
in the history of medicine, there's never been anything like this. It took us 1,000 years to figure out what syphilis was. We identified an epidemic. We figured out what the syndrome was. We figured out a causative agent. And we initiated treatment and vaccine research within 10 years. It's unbelievable. There's never been anything like that.
And people are living with it now.
Oh, now it's chronic illness like diabetes.
But it's controllable.
Oh, yeah. Oh, yeah.
That's amazing.
Yeah, it's amazing.
So now, like in terms of, all right, so that, and then it becomes a relationship show.
Now I'm upset. I don't know why. Because I think you're taking me back to that time, and I'm thinking of all the shit I've taken over the years and struggles to do what's right and to help people and take shit for it is really painful.
Well, I think that once you, the thing is that once you enter the world of celebrity, that, that's what comes with it.
I guess, and people think they know you or your motivation or whatever, and I just examine myself all the time. Like, are you right? You must do this shit. It's our disorder.
But I'm not as big. I'm not as. I don't have anything. I don't have a professionalism. Like I'm not as out there saying like, well, I know.
Not an easy target.
I'm
an easy target.
Yeah. But I mean, you obviously have helped people.
I certainly hope so.
Are you kidding?
That's my goal.
People who grew up on Loveline?
Yeah, I hope so.
I mean, you saved lives, you saved relationships, and when you're in a position that you're in where you're confident, you're a practitioner, there's just people out there going, that guy's going fucking down.
Yeah.
Like, when you make comments.
I don't understand that whole impulse. I got none of that myself, so I understand. I know it's there.
Well, I think that what happens is that because everything's so available that anybody at any time can listen to everything you've ever done or look at it, that, if you have a moment where you misspeak or don't think thoroughly through it and it's reactive, then that becomes everything. That becomes the lens through which we see you. This guy said that these symptoms are from sex abuse, and he shit on all women.
Yeah. Oh, I happened to have the other day. I had a guy. This is awesome. This shows you how the social media can get at you.
Yeah.
I had a guy on Loveline, still doing Loveline, and he calls up and he goes, "My girlfriend." I was incredibly anxious. Girlfriend, she has IC, she has endometriosis, she has fibromyalgia.
I just read about that.
Did you see this
Go
thing?
ahead.
And I go, whoa, hold on a second. I go, wait. He listed like 7 diagnoses, all unrelated, basically. And I go, hey, hang on a second. I go, he's using jargon too, so I know immediately there's something up. I go, I assume you mean interstitial cystitis, and he goes, oh yeah, blah, blah. And I go, okay. So here's the deal. You've listed a whole array of garbage bag diagnoses, meaning doctors pouring things into the garbage bag to try to explain something they can't explain. Yeah. Not that these things don't exist.
Right.
Not that they are very serious diagnoses for people that have them.
You're using slang, medical slang.
Yeah. This woman, I don't think we might consider maybe she doesn't have any of these things. And I said maybe it makes me think. With your anxiety and this list of unrelated diagnoses, you can argue about how unrelated or not they are. Maybe she had sexual trauma growing up. Maybe this is all about, because it seems all centered around her pelvis, and he's concerned because he doesn't get to have sex because of sexual. Right. And I go, was there severe sexual abuse? Yes, you were severely sexual abused. And I go, why don't you go look at that? Maybe stop with all the medical stuff and go get that treated.
Right.
That was the call. It was Alan Thicke was the guest. Alan Thicke was sitting there. It was a 15-second call. The endometriosis world came after me like you can't believe, for saying endometriosis is a garbage bag diagnosis.
Which was not
at all.
They misunderstood garbage bag.
Right. And of course endometriosis is a very serious thing. It causes infertility. Yeah. It's painful. It's profound. It's common.
Right. But you were dealing with the psychology and the number of possible ailments.
She didn't have it. She didn't. I suspect that she probably didn't have that, or if she did, it wasn't what was causing all this anxiety for this guy. She may have also had it. You know, but I'm just saying, consider this other thing also.
Isn't it fascinating? Like, you know, just like
so painful, so painful
for you to be misunderstood. But that's going to happen in a public forum. If you're in a public forum every fucking day, how the hell?
I guess so. But maybe you can help me. Maybe it's part of, because we share this codependency thing. When you're codependent, you like people. You want people to like you back. You know, you like that.
Well, I think that it becomes tricky when, you know, you're as together as you are, or it's hard, you know, when you're a spokesperson or somebody who's in the public eye and you're like a codependent. Your instinct is like, I want to help, and when you don't help, you take it personally.
Yes.
It's hard not to mistake that taking it personally as narcissistic.
Oh, that's interesting. So you help me.
Do you understand what I'm saying?
Yeah, I do. Well, it is kind of a narcissism in a way.
Well, yeah.
It is. Hey, it's all about me. Yeah.
But there's something healthy about some narcissism. I mean,
but you're right. There is a covert narcissism in codependency.
It's all about that.
You're right. It's wounding this stuff.
And, right. That you didn't take. That you misunderstood me.
Yeah, I know. Yeah. Good. It's funny now.
Now, in dealing with that, it's profound to me. Just you know, what's happened culturally, sexually, and I didn't plan to talk about this, but I mean, since you obviously have opinions on it, the pornification.
Oh yeah, it's interesting, right?
Of culture. Well, like I talk about it on stage, that, you know, porn is insidious. It's brain altering.
Absolutely.
Almost permanently. If
Probably.
You're not careful.
We don't know.
No, I know. I saw porn too young, and I'm struggling backwards for my entire life.
We do know that a young exposure can cause sexual compulsions and addictions. I mean, it shatters the upper limits of the young brain's ability to manage and regulate stuff that's coming in. It's almost like a trauma.
But it's desensitizing. Mm-hmm. It's fucking profound, dude. And I don't know when it happened. I don't know if the business is that big to where, like, I mean, in the 80s, there was a fucking, you know, granted a right-wing commission to sort of like harness and assess it. But now it's just sort of like, yeah, porn is porn. You can do it. You and I can watch it right now. I mean, there used to be some difficulty in getting it. But, and again, I'm no Puritan, but it just seems to me that it has the same effect as a drug. And that, and that, you know, I have a good friend of mine, my sponsor actually is, you know, deals with sexual addiction. Yeah. And I think that the repercussions of that epidemic we don't even fucking know.
We have no idea. We have no idea yet. I worry about what's going to happen to this current generation that sort of, we don't know, and they're living in it. The one thing I've seen is a lot of young males, you're going to love this, young males are sort of like not interested in relationships.
Right.
Like, no, women, they're difficult, they're tough.
Yeah.
I got my porn, I'm fine.
Yeah.
Can you imagine?
Or I got my hookup, I'm fine.
Hookup, porn, whatever, just some arousing, whatever.
Well, this is interesting because, you know, Wilhelm Reich, you know, who wrote early on, who got, you know, kind of pushed out of psychiatry for it, said that if we can unleash, you know, and demystify and take away the guilt and repression around sexuality in this culture, and he was going on Freud's idea that repression was why everyone was neurotic, that we could fix the culture and create an unneurotic populace if people didn't stigmatize sexuality.
What do you think?
Well, we're living in it.
Yeah, it's not working out so good. it's concerning. Different set of problems. That's right.
Maybe kids are less neurotic, and maybe they're more comfortably sexually. But I don't know that, you know, by taking away the meaning of intimacy on that level is proactive.
No, it's problematic. Yeah, because there is biological intimacy associated with it that we can't escape.
Right.
And if you're denying it, that has consequences. Right. It does. And so people need to be respectful of, you know, what happens when two people are close like that.
Oh, I see what you're saying. So there's no free ride.
No, it's our brains. Our, you know, oxytocin comes out. We have all kinds of feelings, and we can do it sometimes,
right?
But sometimes we cannot. And how to identify those times and what the price is for doing it, not worked out.
Well, getting back to this other thing about you know about how reality shows characterize things. The weird thing about me is that, like, knowing from the inside, you know, as somebody who's a drug addict, as somebody who's spent time in recovery, it's interesting. Like even shows like Intervention, which kills me all the time, because like I think that the intervention library is like a first step library, is that you want that because as somebody who's in it, even if it's exploitive, what's being captured there is truly the struggle of it. Is like you wonder whether that person's gonna run or go into treatment.
Yeah.
But even as somebody who's in it, like, okay, they're in treatment, I'm like, who knows what's going to happen now?
Right,
I'm glad they made it and they'll get the information. But even when they're back like a year later, I'm like, nah, she's still not out of the woods, man.
That's right.
You're not out of the fucking woods for 5 years. Then you hear
years.
When
years
I hear people, dude, lately I've been hearing about people who are relapsing at 17, 18 years. I'm like, oh my God.
Oh.
Because like you're an old person now and you're like, well, maybe it doesn't have the same.
I don't give a shit.
Well, no, I don't think it's I don't give a shit. I'm like, it can't be as strong as it was. Do you know, like that whole idea?
Thinking that I can handle it now because I've got so many years of good built-up regulation.
Right. How could it possibly?
And you know what? And usually when they do that, it's a slow evolution.
Or very quick.
Or very quick. Sometimes very quick. But usually what I've seen is usually slow because they usually kind of can handle it a little bit different than they used to. And then, now it's game on. And then off they go.
I never forget that feeling of just knowing that, like, you've never been there's never been a casual approach to any of this shit.
Good.
Yeah.
You're
so
lucky.
what do you think it is after all this experience? How do you characterize? Do you use a disease model? Is that something?
100%. That's what it is.
Yeah.
I mean, we just know so much about it. That's what that is. The mystery is how do you get somebody to be willing, right? Mm-hmm. And I'm of the opinion that the magic of that is interpersonal. It's an interpersonal disease with an interpersonal solution. It becomes between you and your drugs, but ultimately, if you can interpose people into the wiring, that's where you find your way out. But addicts don't trust. They've been severely traumatized. They don't know how to get that closeness going.
They're manipulators too.
But that's incumbent upon us, and that's the piece that doctors don't get at all, is how they're being manipulated. And I have to bring people in the room with me to sort of double check me, because I'm, as not a recovering person, I can get taken advantage of really easily. But I kind of know. I've cultivated the word whatever. I've learned to expect everything and anything from addicts, and I do the best I can. But getting in the frame, getting them to be close, is an unusual experience for them. I feel like that's other than getting them detoxed and enrolled, my instrument, what I use, my medical instrument is my body to get in the frame of closeness with another person. And that's hard work to get them there and keep them there. So I feel like I serve as the first. And I just talked to Jeremy London over the weekend, and I haven't talked to him in years. And we treated him on one of the shows, and he's now got married, had a kid, flourishing, and
worked.
I thought to myself, I go, wow, why would he called me to sort of connect about his success in life? And I thought, wow, I guess that makes sense, because he really appreciated that closeness we had in the brief time we were together. It was different for him, and it became a model for things he could do in recovery.
Also, the other thing is about that closeness is also learning how that through the context of like recovery or whatever, that you can help others.
Oh, well, that's just reversing closeness.
That's right.
That's practicing boundaries and creating meaning.
Right.
Leading a good life.
Right. But you got to learn that when you're a drug addict.
You got to, yeah.
That's the tricky thing. Is that sort of like, I just want to worry about me, fuck it all.
No.
But but then to really feel the fact that if you just listen to someone else's problems, you're not thinking about you. And it's a relief, and you feel like you've done something good.
Right. And it's not learning, it's experiencing. It's an experiential process, and you have to first experience. But here's the part that I think people miss. It's not just serving soup at a soup kitchen. It's identifying something in another person that you're being of service to.
Learning empathy.
It's hard.
I know. It took me doing this podcast to really get it.
No shit.
Yeah.
Do you sponsor people?
I don't.
Oh, we may need to.
I know.
Think about that.
Yeah. I mean,
that might be really. Whew.
I think I sponsor hundreds twice a week.
Yeah. I understand.
All right, let's deal with one other thing that we should talk about. And I don't usually do interviews like this, but I might as well do it with you. The accusations of shilling medicine.
Me?
Yeah.
Okay.
What's that about? The contract on the Wellbutrin? Or the
right. Here's and no one wants to listen to me on this one either.
So you've defended yourself on this.
I've tried, but the perception is so bizarre. I just sort of whatever.
But wait, before you get into it, I do know that growing up with a doctor, that pharmaceutical reps come to the office, they give you samples. You want to be up on the latest things and the most positive treatments for certain things.
Right.
So you're
and you want to get samples for your patients for free because they can't afford stuff.
Yeah. So, I mean, I get that part of it.
Yeah.
That if you believe in Western medicine, this is part of the reality of how you do business. Now.
Well, really now, I mean, things have changed so much in the last 15 or 20 years.
Right.
Now we don't let them in the office. They mail us the samples, everything. We don't even accept a pen anymore. Now, you got to remember, I come from a time when we got our first stethoscope from Lilly. You know, it was considered collaborative relationship.
Right.
I had when I was a chief resident, drug companies paid for all of our speakers. Now, I made sure that whatever they spoke on, I chose, had nothing to do with their products, but they paid for it.
But but it wasn't seen as nefarious.
It was collaborative. It was seen collaborative, and it became increasingly clear that it was nefarious.
Okay.
15 years ago, I accepted money to do a campaign. 15 years ago, to do a campaign. Yeah,
the rage in your eyes here.
To do a campaign, and here was the campaign. Maybe you shouldn't take antidepressant medicine because it can screw with your libido and ruin your relationships. Mm-hmm. That was the campaign. Mm-hmm. That's it. That's the campaign.
Okay.
I wrote a book. I gave lectures. I did television. And I opened the book to see if my memory was right. And not anywhere in the book does it mention Wellbutrin. Not one place does it mention it. Wellbutrin is one of the antidepressants that does not cause that side effect. It's not an SSRI. Now, back in the day, people were not discussing this. And I was on Loveline, marriages were being ruined because people were being put on SSRIs and they'd lose their libido. They couldn't function sexually. And I was like, this is an important campaign. I did it for 2 years. It was a major part of my life going around doing this.
And also, they didn't know the success rate or the side effects necessarily, or whether or not it was going to work.
It was awful what I was seeing, and I was anxious to do this. I mean, these people paid to put me on TV and found ways to put in lecture halls. Anyway, the Justice Department got on that company for advocating off-label use of their medicine. They found a radio interview I did where they asked me, what do you do if somebody gets this? And I said, well, here's what I do. This is what I do. This is what I do. I switch people. If somebody needs an antidepressant, I switch them to Wellbutrin, Cerazone, or Remeron. And occasionally I'll add Wellbutrin to the SSRIs if it's some compelling reason to keep on the SSRIs. And that's what I do.
Were you paid to do that?
To say that?
Yeah.
No.
So you never received money for it?
Oh, yes. I was paid for the campaign. It was my job for 2 years.
Right.
It was a major piece of my life. I was going around doing these lectures.
But you believed in Wellbutrin?
No. I believed in not using antidepressants.
Oh.
That was the campaign.
But
the campaign was...
Who gave you that money?
The Wellbutrin people, but they didn't. They were allowing me to have my opinion about because then somebody, of course, would come in and go, "Well, here's a drug that doesn't cause that." That was not me.
Okay.
Though when they would ask me what I did in practice, which they did on one radio show that they found, I answered, "That's what I do in my practice because that's what I did." But that was not an on-label thing, so that's where it became an issue. You've never heard me say use X, Y, or Z medication. Right. No one has ever heard me say that because I don't do that. I just don't.
Where do you stand on Viagra, Cialis?
I take it because you take it for 1 year after your prostatectomy.
Yeah,
that's what you take.
It's exciting, right?
If you got a prostatectomy, it saves your boner. It's an important thing.
So in those cases, I mean, as recreationally used?
No. Listen, here's the deal. Here's what I grew up with. I grew up with, and I hope you grew up with the same. My dad would always say, medicines are bad. Mm-hmm. Do not take medicine. People overuse medicine. I didn't receive an antibiotic until I was like 14.
My dad was the opposite.
And then it was like only under these extreme circumstances and with great all right, you're about to take a medication. And I listen, most of what I did in the psychiatric hospital when I was running the medical service was dealing with the side effects of medication. I have a profound concern about the medicalization of all this and how dangerous medicines are. Profound.
Mm-hmm. Because they don't know what
Forget long term. I've seen short term disasters. Right. Lots of them.
Yeah.
Lots.
No, my dad was different. My dad was like, take this, take that, take this, and now somehow or another, being a guy who was deeply rooted in that, he's become completely holistic.
Oh, isn't that interesting?
All vitamins now, which is its own.
Well,
problem.
I mean, there's definitely. Listen, like I said, I have genetic issues in my family. I'm glad I can fight it back with medication.
Right.
But that's stuff people need to work out with their physician. That's not like, hey, you should take blah, 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 blah. No.
I got to get you to look at my numbers after.
We'll be happy to.
So, all right, so we feel good? You feel good?
No, I feel horrible.
What can I do?
This stuff makes me just so upset. So upset. Because my intent was to do good. And when people started going, ugh, It makes me feel terrible.
Well, I mean, I think that, when they
I hate being defensive. I don't like to defend myself.
No, I know, but I think that when they hung the deaths of those people on either suicides and from the Rehab show and all that, I don't know that people really understand the depth of the illness, and that I think that was just a predatory press looking to hang you up.
It's not fun to hear the successes. My wife wants to put together a web page that gives commentary for each of the people we treated about how their experience was like.
But this is also tricky around the issue of anonymity as well.
That's a whole. Bob and I spent lots of time talking about that. We actually studied the 11th tradition very carefully to try to understand how we raise awareness, help people understand what this thing is without violating tradition.
With keeping AA out of it.
We never said that. We never used that word.
I know.
We even at first, by the way, we never used the word steps. And then one of the biggest criticisms we got was, "Where's the step work? Don't you do step work?" Like, oh, Jesus.
Can't. Yeah. So. It's very tricky. And and then when you talk publicly about it, you do open yourself. Like I've gotten some backlash, but not much from people who are like, "There's other ways other than AA."
Oh.
Well, yeah, maybe there is. There's plenty of other ways. Whatever you're going to do, whatever you got to do.
I just do what I see exciting recoveries and flourishing lives restored. That's I wanted to be. That's why I originally got into it. I wanted to be a part of that.
Look, I took your fucking narcissist test.
Oh yeah, you got that? How'd you do?
I did better than I thought.
14, 16?
14.
Yeah, that's where the co's end up.
But in light of that,
yeah.
It was surprising to me, but it makes sense in light of that the only one that was high was superiority.
Nice. Well, you are superior. It's good.
Huh?
Maybe, sometimes cigar is just a good smoke. Maybe you are superior.
Maybe I'm what?
Superior.
I don't know.
If what's interesting is if you had taken it back when you were using,
exactly,
you would have been.
That's what I knew.
Yeah.
When I was looking at these questions, I'm like, well, I used to be like that.
Yeah.
I'm really not. I can't say that I am anymore.
Right.
And
that's wonderful.
That was mind blowing because that is exactly what I thought. It's like all these answers, like I used to be like that, and I'm not anymore. And none of it would have happened without recovery. And that, I definitely noticed that.
Yeah.
And I definitely see the change in people. I know, if I'm in a meeting and someone's telling their story, that moment where the hand of AA is there, I'll fucking get choked up no matter what. Mm. I get choked up transitions in people's lives like that all the time. And when they sit in here and tell me their story, yeah, I'm just sort of like, because people can change. I mean, there's some things that you can't change, but you can act differently.
It's hard.
Yeah.
It's really hard. And people are very glib about change. It's profound.
It's
changing who we are.
Because there are some people that are like, people don't change. Some things, fundamentally, they may not. But they can certainly make different decisions for themselves cognitively and get used to that.
And that will change you.
That's right.
Yeah. You will change. Whether you change from the outside in or the inside out, it really is what we should be doing here, right?
Right.
We should be helping each other out. We should be serving one another. Right? We should be. That's right. When people talk about people don't talk about good lives anymore.
Yeah.
How do you lead a good life?
Yeah.
No one ever talks about that anymore.
Who the hell knows what it is?
It's being with other people for sure.
I know, and and I don't do enough of that.
Bullshit.
Well, I mean, here I do it, but at night, I'm like, what am I going to do? I'll go to the comedy club. I know those guys.
It's one thing we didn't talk about is where spirituality and religion, all this stuff fits in with all this. That's where people freak out. That's where people freak out.
Here's my take.
That's where Doug Stanhope goes insane because.
Here's where here's my stand on it.
Go ahead.
My stand on it is like, you don't need a God to have faith.
Correct.
And
totally agree.
Yeah, and the truth of the matter is that to characterize AA as some sort of religious cult is peculiar because there's no bigger room full of fucking rebels and fucking people who will just want to fuck God at every turn.
Yeah.
Than that.
Yeah.
Now the big thing that you realize it's the idea of surrender. This was the hardest part. That's where people get hung up. It's you're powerless. That's bullshit.
Yeah.
You're missing the point.
Yes.
The point is that however you're going to take that leap of faith that'll enable you to know in your heart that most things you have no control over.
Yes.
Almost everything.
Yes.
99% you have control about what you're putting in your mouth when you're sitting at dinner.
And the scary part is when you're an addict, you also don't have control over a lot of what you're impulsively and wanting and willing and wishing and all stuff. Your thoughts, you can't even trust your thinking.
Can't trust your instincts.
Yeah.
Because they're fucked.
At that point.
Right, at that point. But that's the misconception, that powerlessness is somehow giving up. It's really just acknowledging
Control. So
Yeah.
I tell people if I'm talking in recovery, I say, like, don't fucking worry about the higher power right now.
Yeah.
You might not have to worry about it ever. You just have to know that it's not you and that faith is possible.
Yep. That's it.
Yeah.
And some people need a more elaborate concept. And
And
for
they
them, fantastic. They can go as far as they want with it.
Of your understanding.
Of their understanding. But here's how I understand it, is that in order for people, addicts control everything. And in order for them to experience powerlessness, they have to let go of control. And in order for humans to let go of control, they have to have faith that things aren't going to fall apart, or the world's not going to come off its axis.
That's right.
I have patients saying things like, I felt like I was carrying the whole world on my shoulder. I'm surprised the world didn't end when I let go, when I didn't have control. They literally believe stuff like that in their emotionally. So it's just the faith that things will be okay.
Yeah, you can have faith in people. You can have faith in whatever.
The laws of physics.
Whatever
laws
you
of
want.
physics.
Whatever
Things
you
will
want.
continue to be the same as they've always been in physics. That's all.
At
That's
least
good
for
enough.
the next 10 minutes.
That's all you need. That's all you need. But here's the thing with powerlessness, though, is that many addicts, particularly significant addicts, severe addicts, people that I would see, people that need to see me, because there's spectrum, as we've talked about.
Sure.
You know, but if you're bad enough, you need to see me. You had trauma in childhood, and the common experience of trauma in childhood is profound powerlessness, and it's traumatizing to think about being powerless again. And that's one of the resistances. That's one of the your disease doesn't want to have it either. Your disease wants to keep in control, but also the trauma.
And also, sadly, with that type of trauma, it's something that culturally and individually people want to repress.
Well, forget culture individually. Your brain just does that. Your brain puts it way off in the back.
Right.
And your thinking about it is, I've dealt with that. When in fact, what's happened is you actually have a part of your emotional brain that's literally diswired, unwired from the rest of your system.
Protect you.
Because it's overwhelming.
Right.
But it's still there.
Right.
And it's embedded in your body now.
It's interesting.
And it will continue to be a source of symptoms until you rewire back into that piece.
Right. But see,
that only happens in an interpersonal context. And if you don't trust other people, you can never rewire it.
That's right. And the enemies or the opposers of therapy, of recovery and all this are the people that say, look, what we just talked about is promoting victimhood. But you know what I'm saying?
Yeah.
So that's the criticism that the therapy business and the recovery business is all about keeping people in a victim mode to continue
or dependent or needing other people.
And it's like it's a little crazy because there's so much more nuance in that.
Oh my God! And we know the biology. We know what's needed.
Look, but the other side of that is it's like, oh, if you're like fuck that, it's all willpower. It's like I'm not a victim.
Yeah.
That the possibilities for you pushing that down the line genetically or behaviorally into generations is massive.
Yeah, terrible.
All right. So now do we feel better?
I do feel better.
All right. It's great talking to you.
You too.
Okay, see, that was good. That was good. See, Dr. Drew, a guy with opinions, but a guy and a doctor. And he helped me out, and no, I haven't gone to get my thyroid checked yet, and I got to write that down. Completely forgot about it. Go to WTF Pod for all your WTF Pod needs. Go visit our sponsor, Untuckit.com. The fall line was just released, and they've got all the best fall styles in their online store. And Untuckit.com offers free shipping. So go to Untuckit.com and use promo code PODCAST to buy yourself some shirts designed to be worn untucked at the perfect length. The right shirt can make all the difference. Untuckit.com. Like, does that change your opinion about Dr. Drew? I enjoyed him. I thought he was forthright, stand-up dude. But what do we got going now? Did I mention WTFpod.com? Am I playing guitar? Let's do some electric. Let's play some electric guitar. This is not I don't even know who listens to this at this point. Like, are people out? Are they off? Did they turn it off? Oh my God, I have a hard time breathing. The writing of the show is going well. Ooh, how loud is that for you guys? Huh? This is a Stratocaster.